Good morning, everyone. Thank you all for attending this Major 2 Career panel hosted by the Center for Career and Experiential Education. My name is Barbara Sweeney. I am, first and foremost, an alum of this program, soon to be a URI parent, which makes me very proud. My daughter will be attending here in the fall. My current position is part-time faculty in HDF, and I'm also the coordinator for food security outreach within the Dean of Students office. So I wear a couple of hats, but I'm so very happy to be here showcasing the amazing talents of our alumni, both recent and not so recent. So I'm going to sort of kick it over to our panelists who are here, our alumni panelists, and we can start with Susan, because I see you first on my screen. If you could just introduce yourself and your current position title.
Sure, thanks, Barbara. I am Susan Soares. I am a graduate of 93 undergrad, and I am currently the Senior Clinical Implementation Specialist at a software company. And I'm a therapist and a life coach. Sorry, almost forgot that. Multiple hats, like Barb.
So full disclosure, Susan and I have been best friends for over 30 years, which makes us like 31 now. And so I know a lot about Susan personally, and I'm so very happy that she's here, but her path has taken some very interesting turns that I hope you'll be able to talk about as we get further into the discussion. But let's jump to Leanne.
Thank you, Barbara. So of course, my name is Leanne, and I am a recent graduate of URI of last year. I'm also graduating again this upcoming May for my Bachelor of Arts in Psychology. My title is a person-centered options counselor here at Child and Family, and I hope to go more in depth about what that is later on.
Oh, thank you, Leanne, and congratulations on getting another degree. My goodness, you must have more than 24 hours in your day. That's fantastic. And Victoria Parker is our next panelist.
Hi, good morning, everyone. I'm Victoria Parker. I completed my undergraduate at URI in 2016, and I'm currently the Alzheimer's Disease and Related Disorders Program Manager at the Rhode Island Department of Health.
Thank you, Victoria. And I love that your path has taken you toward working with folks more in the end of their lifespan. I know that many of our students are very interested in working with children and families. So I love that we have the perspective of someone who's worked sort of at the other end of the lifespan and the information you can bring to our audience. So Victoria, why don't we stick with you if that's okay, and address the first question. Just tell us about your career journey after URI and what position did you start in? We know this is your second position now, at least, and how did you transition into the role that you currently have at Department of Health?
Sure. So I, in the HDF program, did my internship in my senior year in 2016, and I interned at an organization called PACE, P-A-C-E, which is a alternative healthcare model that services older adults 55 and up who live in the community. When I first started at URI, I thought I wanted to be in early childhood, as many people do as they come to the Human Development Program. And then I actually had a position before PACE at the Child Development Center right on campus in the Kingston campus. And I realized really quickly I did not want to work with children. So that experience kind of led me to the other end of the spectrum, as Barbara mentioned, and started working with older adults and really had an interest in supporting aging populations and keeping them in the community. And so I worked at PACE. I was in a couple of different roles. I started out in the activities department, working in their day program, doing activities one-on-one with clients that were coming in to the day program. I then transitioned to a position that was called the Education and Research Coordinator. And in that position, I oversaw the student internship program, which was a nice full circle for me, having been an intern and now overseeing interns. It was really great. And so had a nice opportunity there to work on different projects and oversee student interns. And I had been at PACE for about 5 years when COVID hit. So you might have heard the term of the Great Resignation and kind of thinking about wanting to change paths during the pandemic. And that's exactly what happened to me. I sort of felt like I had been in this role for about 5 years and wanted a taste of something different. And so I had been looking at different positions and ended up at the Department of Health, where I now oversee a grant that is awarded to the state through CDC, Centers for Disease Prevention and Control. And I oversee that grant, and I do a lot of different reporting and work to support people living with dementia across the state. So happy to talk more about grant writing and what that looks like. I know another question that we have is about certain skills, and certainly grant writing is one of them. But I think I'll leave it at that for now, unless you want me to keep going, Barbara.
We'll definitely come back to that, Victoria.
Okay.
I love that you're sort of a macro representative on our panel. So sort of looking at that policy and program issue and grant writing, which are all great skills that our students and alums will definitely use. So thank you. I'll be anxious to hear more from you about that. And working in such an exciting field where I think the research is just coming up nearly every day with new information about how we can not only treat Alzheimer's and related dementia, but also prevent them. So that.
Yeah, it's been really interesting. At the health department, there are several, and I'll say too, when I started working at the health department and even just applying, I thought in my mind that the Rhode Island Department of Health did like COVID vaccine and like testing your soil and like, doing, like air pollution, that kind of stuff. I had no idea that the health department has an entire division that's focused on addressing chronic disease and public health. And so within my center, there is a diabetes program, an arthritis program, asthma, women's cancer screening, Alzheimer's is new. And these programs have existed for 10, 20 years. The Alzheimer's program is now 3 years old. So we're very new in terms of the chronic disease space, but that makes it more exciting for me because every day there is new research that comes out about managing and treating dementia. So that's been really interesting as well.
I love it. And that's such a great lesson for our students who are here is if you think you're interested in an agency or perhaps not interested in an agency, dig a little bit deeper and maybe you'll find sort of a wonderful surprise that there's actually it's actually a great placement for you. So that's great advice. So we'll switch back to Leanne if we can. And Leanne, ask you the same question, sort of tell us about your journey after URI, though it's rather short. And you've maintained your ties with URI, but how did you enter this position and kind of what is the next step for you?
Okay, sure. So of course, part of my curriculum was also to find an internship during my senior year, which I was able to thanks to my advisor and thanks to my classmate at Child and Family. Ironically, at Child and Family, they were actually looking for someone to fill out a grant position, which is called Person-Centered Options Counseling. That was the grant funded by the state. And thanks to my internship, I was able to learn more about the program. It was very, very new. So of course, I was new to it and a lot of my colleagues were also new to it. But thankfully, after my internship, I stayed on after 11 months. So until now. So now it's been 11 months. And so I feel very confident in person-centered options counseling just because, excuse me, the grant was fairly new to the state of Rhode Island. Doesn't mean it hasn't been implemented in all of our day-to-day lives. We actually do use person-centered skills within our conversations. Just because we don't actually see it doesn't mean we don't use it. So I actually thought it was pretty interesting. And now I'm still here within Child and Family just because I enjoy my job, I enjoy my colleagues, and at the moment I'm happy with my position. Excuse me.
So, wonderful! What a great again another couple lessons from what you just said, which is talk to your advisor, connect with your advisor, get their advice. It's within their name, and also how important having a great internship or field placement can be because we know it does lead to potential career options. So definitely seek out something that really interests you because it could end up turning into the beginning of your career. And I love that both you and Victoria are working on sort of new grants, new to the state, and helping sort of be leaders at a very young age within our state. So that's wonderful. We'll look forward to hearing more about what person-centered options counseling means in the next few minutes. But let's take it over to Susan, who's got a bit of a longer journey and one with perhaps some more twists and turns after URI. And as Susan, tell us, we've got an hour, so tell us how you got from there to here.
So before I graduated, I had also done an internship at Butler Hospital on their partial hospital program. And that was absolutely key to my next decisions in life. I worked at a residential treatment program my last semester of school, but then I left school and I really made some good connections at Butler, and I got a job in their research department. So psychology, psychiatry was kind of my field. Mental health was where I was going. I knew I wanted to be clinical. So I did that for a year before graduate school. And then I went for my master's in social work at Simmons in Boston. And then from there, I'll give you like the quick version of I did inpatient at St. Joseph's Hospital. It was in South Providence, and it's still there, but they don't have a psych unit there. And then I coordinated an eating disorders program at Butler Hospital. And I moved to a care management position at Butler when they had a Blue Cross Blue Shield capitated contract in the late 90s. From there, I went to work at another inpatient program at Bacchus in Norwich, had a baby and wanted to work part-time. So I was at Emma Pendleton Bradley Hospital doing crisis work. I also picked up a job as a student assistance counselor up in a Cumberland school. And then I ended up, kind of left those and ended up in a small community mental health center in Northeast Connecticut, where I live, as a coordinator of emergency services. So it was a strictly outpatient program. And then from there became the manager of clinical services for adults. I've done child and adult, but for adults. And then there was a pivot because I really was experiencing some pretty significant burnout in the clinical job that I was in at the community mental health center. And there was an opportunity to move into the IT department. And the clinical social work or, mental health is always a little bit behind physical health. And so we were just starting to get more and more into the electronic health record. And that just ended up being a place where I really, I thrived learning about that. When I was in grad school, I was either going to go into psychology or mechanical engineering. I know there's two totally different sides of the spectrum, but this was at a point where I could kind of leverage some of those other very logical skills and was able to become the application support manager there. Still burning out a little bit, and ended up working for getting a job with a software company where I am now. And the software company is an electronic health record for behavioral health agencies. So as a clinician working for a software company, I am strategically the person who can help them make decisions about how the software should work so that it works for the people who are going to be using it. If you're just having IT guys build a software without a context, it's tricky. So I got into the implementation department. So where I was helping behavioral health agencies implement the software. I joke around that I never really left clinical work because that job was all about having people change their mindset and go from one place to another goal. And then from there, I more recently kind of got back into more direct clinical care and picked up, I have a small caseload of therapy clients, and I also got certified in life coaching. So I do the whole spectrum from kind of more severe clinical all the way down to I have a goal I want to achieve. And just this the combination of all of those really just fills me up. And clinical staff in tech, there's a whole new thing on LinkedIn, clinicians in tech, therapists in tech. And so there's just more and more of us going into fields other than direct clinical care, which I get really excited to talk to anybody about.
I need a nap. Susan, thank you. I love how you described your path and how you made pivots to accommodate your personal life and having a child and doing different things that sort of fed you and met your needs, both sort of logistical needs as well as your more affective needs, and are one of those great sort of translators of or bridge, if you will, from clinicians to non-clinicians. Helping IT folks figure out how to sort of humanize the electronic medical records experience, if you can humanize something, and make it work for the clients. And it's such a great reflection of how really universal our skills are. When you have person-centered skills, you can really apply them both to clients, but also, as you mentioned, sort of with your collateral folks and helping them understand.
Yeah.
So we'll stay with you, Susan, if that's okay. And
sure.
You could answer this question based on any of the positions you've had, but how has your degree assisted you in the position you're in or the ones you've had? And I suspect you could probably answer that for all of them.
Yeah, I think one of the greatest things about URI that I got out of, which I think is also like another number 3 question, but it was the internship. And I'm absolutely thrilled that both our other panelists who are on here have also done internships. I cannot emphasize that enough because it really helped me talking to the other people, the other social workers at Butler Hospital, the nurses at Butler Hospital. There was a time when I thought I wanted to be a nurse practitioner and realized I pass out when I see blood or needles. So I stayed in social work for everybody's benefit. But just being able to be exposed to the people who were doing the things I thought I wanted to do, both helped me realize the direction I wanted to go and what I didn't want, right? So talking about working with kids for a while and then realizing, nope, I don't want to work with kids. Just those experiences have really, shaped me in a way that like every job I had was a little bit closer to alignment with me and to the point where I am now at 50 something, feeling pretty aligned. But it really, the internship was key, and also the friendships you make are lifelong.
I'm so glad, Susan, you talked about identifying what you, not only what you want to do and getting closer and closer to that with each position, that it's not like your first day on your first job out of school, you're going to be in the right place. It's a process,
right.
But also finding out what you don't like to do. When I teach, often students will say to me, oh, I took this class and I thought I'd love it and I hated it, or I did this internship and I really didn't like it. And I say, that's great. It's really important to identify. There's too many options out there. So the more you can filter out and figure out what you don't want, you'll get to that alignment. So thank you. We'll go back to Leanne. And Leanne, if you could answer that, how has your degree assisted you in the position that you're in?
Yeah, so my degree in HDF, I had a focus on family and community settings. And thanks to my curriculum, I was able to take the 2 field experience classes, HDF 312, which is adult development, and HDF 312, which is later adulthood growth and development. And those 2 classes actually started and continued my interest in gerontology and a focus on older adults, actually. Despite the name child and family, we do have programs for all different ages. And I'm actually in part of the aging well department. So thanks to my degree, I was able to learn about older adults and how to communicate with them efficiently. Before my internship for child and family, I actually interned with Sky Lido who was my advisor and professor at the time, with cyber seniors. And I know Ashley must be taking part of cyber seniors now, right? And so I really do have to thank cyber seniors for introducing me to seniors and talking to them efficiently and learning how to communicate them and just learning how to be patient with older adults because I really do love the population. And I feel that my job is pretty consistent with older adults, even though it doesn't just have to be older adults, but I find myself working really well with them. And so thanks to my HDF degree, I really do have to thank all the classes and the curriculum, the classes that I had to take to finish my curriculum in HDF.
That's awesome. Thank you, Leanne, for sharing that. And again, that idea of sort of unexpected, an unexpected path, but you found a passion. And, I think, again, so many of us focus on early childhood and adolescents and families, which is important, and we'll continue to have research and increase our knowledge about the processes of these individuals and families. But I think we're going to continue to learn even more about our older generation as lifespan increases, and we can keep people alive longer, but not necessarily with quality of life. So I think it's a very rich area for further study and development. So it's great that we have people like you who are on the front lines working with individuals. So in a few minutes, we'll hear more about sort of what your daily life looks like, but let's kick it over to Victoria. And Victoria, same question, sort of how has your degree helped you in the position you were in and the position you're in now?
Yeah, I think when I'm sitting here thinking back to like, what building was I in on the Kingston campus and what courses was I taking? But I'm remembering like a marriage and family therapy course that I took. And I know one of the paths for people on HDF is potentially wanting to become a marriage family therapist or kind of pursue that role. And it certainly was not an interest of mine, but still a course that I took. And I'm thinking about how some of the courses, although the content was not exactly what I wanted to do, I'm thinking about like the relationship building skills that you learn or the communication skills that you learn. I think maybe I had the perception in my undergrad that when I joined the workforce that adults would know how to communicate effectively, and that's not always the case. So I think I've leaned on the skills that you learn in those courses related to just like life skills, relationship building, effective communication, how to moderate conversations between people, how to facilitate meetings and discussions. Those are all skills that, you don't have a course that is necessarily on facilitating a meeting, but it's certainly something that I do in my everyday life. And having had some of those kind of softer skills come through in courses like marriage and family therapy have definitely, led me down a path that has made me an effective communicator to some degree in the workforce. So even though I wasn't, I was probably taking for granted a lot in those courses what was, really being effectively taught to me, but I have pulled out, I think, some of those softer skills through some of the courses that I think other programs within URI don't necessarily get connected to. So certainly, although I was in the moment feeling like this isn't going to be helpful to me, now that I have joined the workforce and I'm putting forward those soft skills, it's certainly been a big help.
I love that. And to our students who almost universally dislike group projects, that's one of the reasons why we assign them. They're incredibly beneficial because you will find that people out in the workforce have different levels. Even with many years of experience, they have different levels of those interpersonal skills, and you may actually be more skilled than many other folks who've been in the industry for a long time. So take advantage of the opportunity to learn and practice those skills. Victoria, we'll stay with you since you're here and on screen. It's sort of a build-in from the previous question, but are there specific skills, work experiences, or academic work that can make students more competitive for positions within your field or within our broad field? You've talked already about how effective your internship was and how effective some of the classes were, but anything you'd like to add to that?
Yeah, this is the skills question, right? So for me, in my role, I have to do a lot of reporting, and I have to apply to grants pretty much annually, which is a lot of work. And grant writing is certainly a skill that is helpful, and just writing in general. Another skill I wanted to mention was kind of like thinking about agencies, partner agencies, how to build partnerships, how to really connect with people, how to like not be terrified of networking and asking a question. I know that was certainly something that was nerve-wracking the first few times you do it, and what has worked for me, and because I still get nervous going to meetings and things in the community, it's like, what are some just easy, I call it like a softball question, like, oh, what led you to your position? That's so interesting. Tell me more about what you do. I think you'll find that people really like to talk about themselves and what they do. So if you can just throw them an easy question, it completely takes the pressure off from you to come up with something to say, and you actively listen to what they're saying, and you might even catch something good. So just being not so fearful of just engaging and just asking that question. And I don't know that that's necessarily like a taught skill, but something that has been really helpful just in maintaining and keeping relationships with people. And then the other skill that I want to mention, I'm so glad, Susan, you talked about your journey and now in technology. I feel like health information technology, HIT, it's almost like a buzzword. And I don't know that there's necessarily a direct path into HIT, certainly not for you, Susan, having listened to your history, but I feel like that's a really emerging field. And understanding like what an electronic medical record is and how people use them to pull data and data analysis using technology, like it's such a need, and it might be something that you would want to consider. I certainly never thought I would get into a technology space, but now having worked in the field for some time, I'm using technology every day, and I'm seeing a lot of need for innovation in that space, particularly in healthcare. So it might be of interest to you as well to think through some IT.
Victoria, thank you. That's a great way to wrap it up, because I think we might often have the mindset of we're working with humans. Like, what could there be that's new about humans? We've been human for tens of thousands of years, but that aspect of, oh, we really need to figure out how to make technology work to support humans, whether it's electronic medical records or it's an HIT, and just even communicating electronically, as we all spend so much time doing. So I love that it's sort of a new twist to an old issue, if you will. So thank you for that advice. Susan, we'll go back to you, and anything you wanted to add. I know you talked about really leveraging your internship.
Probably not. I mean, it really was the internship that got me back. Well, I will. So the internship, and I have to tell you, I'm still in touch with the guy who hired me for that, or agreed to do that, Bob Hamill. He was a nurse over at Butler for many years. And I would say that the more you get out there and in your internships and just make connections with people, like just build relationships with people and email them back, or like reach out to them, because these are the people who maybe are doing what you want to be doing, or they know about what your skill set is versus what your strengths are versus what's out there. And the relationship building, it will carry you. I've gone back to these folks and asked for recommendations and things like that years out after, and they've just been great. So that would be kind of the specific skill I would say, is develop relationships with people and nurture those.
I love that, Susan. Thank you. I know as students, you might be tempted to think sort of in your 13, 14-week blocks. That's how long we're in class or you're in an internship. But remember that both with your faculty, I have many students who come to me for letters of recommendation or ask me about potential job opportunities, as well as in your internships. It doesn't end at the end of that of the semester. And once you get your credit, look at Susan as an example, 30 plus years later, still leveraging her relationship with her first supervisor. So that's great advice. I really love that. So take note of that, students. And Leanne, how about you? Are there specific things you can recall from your time here, your coursework, or you've talked about your internship that you'd recommend to students?
Well, I also agree with Susan, having to keep relations between your professors and old internships definitely are beneficial. I definitely can say that some of my professors definitely helped me out getting an internship just because I formed great relationships with them within the class. Even my advisor, again, going back to my advisor, I was just very lucky that she was my advisor and my professor, and just like a very close friend, if anything, if I could count her as a friend. But before I even go into like the specific work experiences that account coursework that I did that definitely helped me in my field work, I just want to go over what Person-Centered Options Counselor is, just because it will really help me in the explanation. So Person-Centered Options Counseling is an interactive decision support process within older adults that can help people understand and learn about like long-term services and supports that they may need, want, or wish for. And in Person-Centered Options Counseling, what I have to keep, I still have a hard time doing this sometimes, but most of the time I have to understand that it's not my job to tell someone how to do something. It's my job just to inform them about all the decisions that they can make within their viable reach, and then have them understand that they have the option to do anything. And within my coursework, there's a lot of case studies. And within case studies, I feel that it's very beneficial to understand a lot of the casework that we go over in class, because sometimes there's just not one option, or sometimes there is an option that seems very viable, but it might not be what the person wants. And so we also have to understand that in my position, that I want to satisfy the needs and the wants of my patients. So thankfully, through case studies alone and through my internship, I'm able to understand that there's a balance between both. And just going with that mindset, even with outside of work experiences, I find myself having more conversations between friends and families, and being able to find a middle ground for a lot of things, just because I have that in the back of my head. So at first, when I was in the position of my classes, I always groaned at the idea of case studies, because I was like, oh, case studies again. But I can definitely see the benefits now. So I really applaud my professors for giving me those case studies.
I love that you said that it is a wonderful way to practice skills in a safe way, and there's no, sort of a low stakes. If we mess up, it's okay. But I really love, Leanne, that you talked about really an empowerment model for our clients and our consumers. And it's not our job to tell them what to do. It's to help them make the best decision that works for them. I often tell my students, it can be really difficult, but one of the most important parts of the job is recognizing that adults will make decisions that you disagree with. And that's okay, because our job is to help them feel empowered to make the decision. So Leanne, I'm going to stick with you, and I'm going to try to combine the next two questions if we can, because I think they really work together. Sort of taking us through a day in the life of your job. If there is such a thing, I think almost every worker in this field will say, well, no 2 days look alike. They're all very, very different, depending on, myself included, depending on what I need to get done. But sort of a atypical or an amalgam of things that you do within the course of a week. And what do you find most rewarding and challenging about that? You've already identified a challenge of helping people be autonomous, but perhaps something rewarding that you find about it as well.
Yeah, so I can definitely say each day is different, but within a week, it's more or less, it has its ups and it has its downs, just because I talk to multiple people within a day, within a week. Either it's the referrals that I get, which are the clients themselves, or sometimes it's the family member who's concerned about a parent and wants the parent to start thinking about long-term supports and services for them within the home. And some parents, they have to understand that they want to keep their autonomy, but sometimes it's really hard, especially nowadays where they live on the second floor and their mobility issues are starting to come through and they can't really handle the stairs too well. And sometimes we do have to have that hard and difficult talk between, let's say, the adult child now, and the family member. And then we also have to talk to their um, primary care physician and learning about the ADLs and the IADLs that they might need help with. And then that leads into more conversation where I have to talk to sometimes case management agencies outside of Providence, because sometimes I reach out to clients who aren't in the Providence area, or um, sometimes I have more difficult conversations with the contacts because they're the primary care giver of the client, and they're having a really hard time taking care of the client by themselves. So they're looking for help. They're reaching out as hard as they can. And sometimes I do get those calls where, the client might be very emotional over the phone. And of course, it's my job to have them calm down and understand that this is, life. It's really hard decision between them and the client, of course. Um, but most of the time after I get off that phone call, I go to my colleagues sometimes where they have more resources because they have much more experience than I do in the field. So I really love having my colleagues next to me. Or sometimes if they don't have the answers, I'll honestly just go to Google and look up Rhode Island programs for adults within the specific description, and that can also help me. And then I look more into those information and outlooks for my clients. But the most rewarding part of it at the end of the day is that I'm able to find a solution, or maybe not sometimes it's a solution, but I can push them in the right direction. And that's always better than nothing, because I don't want to go at the end of the day and see like, sorry, I have a nothing for you, because I feel like that's the worst possible thing I could say to a client. So no matter what, I'm really stubborn, and I'll always try to find some sort of solution for my clients. Even if I can't help them directly, I always have to push them in the right direction, because sometimes I do think that's the most challenging part, but if I can find something, it's really rewarding. And there are days where my clients will call me just to call me and say thank you. And at the end of the day, that makes the difficult all worth it.
I really admire the way you stated that. And it is such a privilege to do this work and to be able to sort of be invited into people's lives and when they're at their most vulnerable and sort of at most in need, if you will. And so you fill a very important role. Can I ask you, Leanne, have you ever had any kind of pushback from clients or families perhaps who said, you're too young, how could you possibly know what to do around aging and specifically? How would you have any answers for this?
Actually, yeah, when I first started my position, I was very, very inexperienced. I can't even say I'm experienced now, but I definitely have much more experience than I did when I first started off. Um, I understand that my age can definitely be a difficult thing to understand, and understand that I'm trying to help older adults. And there will be some adults who will, nitpick my age and say, how can you really help me if you're this young? You don't know the difficulties that I've been through, which is true. I actually don't. But I would like to say that I grew up in a position where I can find these resources that older adults might not be able to find. And it's not my job it is my job to find these resources for older adults who can't really help for themselves or can't really fend for themselves.
Yeah.
So I try to explain that I understand that you might not be satisfied with your job, but at least give me a chance that maybe I can help you or put you in the right track that will hopefully help you in the near future.
Awesome. We'll never walk in the shoes of our clients, regardless of who we serve. And so we rely on our skills and the lessons we learned in our classes and on our experience. And I love that you also said rely on your colleagues. That's a hugely important part of this work, is having a supportive team that we're a part of. So Leanne, thank you for sharing the challenges and the joys of your job. Victoria, yours is a little bit different because you're working on more of a macro level, so not necessarily direct client care, but kind of walk us through a day and what's most rewarding about and challenging about what you're doing at Department of Health.
Yeah, and I loved, Leanne, your response to the I know I'm young, but let me help you. I have skills. And it still happens, you're too young to be doing that job, or you're too young to be working in an aging population. And I always say to people, that's so interesting you say that, because everyone is aging. I am aging, you are aging, we're all aging. So I just find it funny when people sort of use that language, because I guess we live in an ageist society, and my response to that is that everyone is always aging, even infants are aging. So it's a nice kind of response, and I think it always kind of throws people off, and it's sort of like, oh, okay, yeah, now I can be equal with you. So anyway, day-to-day life at RIDO, which is the Rhode Island Department of Health, it's filled with acronyms, number one. So there is so many acronyms in this state. Oh my goodness, it's alphabet soup. So the first probably 6 months of the job is really just getting used to what it's like to work in state service, because it's very different than community-based organizations or health system positions or other private practice, things like that. So a lot of it is really understanding, like, what are the systems that occur within the state, and what are the kind of start and end points that I can rely on to get my job done, and really understanding kind of how to be in a bureaucratic system. So one thing that I have a program coordinator who reports to me, so I oversee her as a staff person. And one thing I told her when she first started was, it takes 6 months at a minimum just to understand, like, what is your job, what is your role in the bigger picture, and not to feel frustrated when you're get an email and you have no idea what it means, because it's going to take a long time. Someone also told me 6 months is way too short. You should have told her 6 years to really get used to what it's like to work in state service. I'm not saying that's everywhere. I think state service is particularly challenging to kind of understand the ins and outs, and then of course it changes with new governors and things like that. But giving yourself kind of that relief period of time where you are learning what it is that you're supposed to be doing, and kind of perfecting your craft. So that's what I would start with. It takes a long time to kind of understand what it is you're meant to do. But because my job is unlike Leanne's with that kind of direct service position, mine is much more like a systems level change. I kind of see myself as a connector between people in the community who are experiencing dementia or know someone who has dementia, which is a lot of people, and connecting them to the services and supports that are available. I don't provide person-centered options counseling like Leanne does, but I work with agencies that do that, and kind of help them think through strategies or solutions for people with dementia. And bringing them data and understanding, and also funds. We distribute dollars, real money, to people in the community organizations that support people with dementia. So part of it is thinking through a budget and managing and overseeing a budget, money in and money out. How does that work? So that's part of my role. How do I make sure that people are spending money effectively on what they're supposed to be doing? That is contract management. So that's another piece of what I do, is sometimes having difficult discussions with the agencies that we contract with to ensure that they're meeting the deliverables within our scope of work, and understanding what their role is as well. And it's not always difficult conversations. Sometimes it's celebrating with the people that we provide funding to, because they're doing a lot of great work. So that's another really rewarding piece of what I do, is when we give those funds out or we start partnerships and the work is really effective. I oversee and facilitate a lot of I call them like committees or working groups, often partners from different disciplines and different agencies coming together on a regular basis. So a lot of my role is like, well, what are we going to talk about? Setting an agenda, prepping some questions ahead of time to keep the discussion going within those kind of meetings, and like kind of plotting the course forward. In that role, I don't do a lot of subject matter expertise. That's really the people that I'm bringing together are the subject matter experts. But my role is really asking those questions. Well, what are we going to do next? What is our next step? How are we going to implement all of this great work? And kind of thinking that strategy building piece. There's a lot of other things that I do. There's a lot of really great committees that happen kind of throughout the state that I get to participate in. But a lot of it, I would say, is more of that kind of strategy thinking, getting us to that next point, being that kind of connector, that bridge between state service and community service. And some of the more specific, work like overseeing a budget and overseeing contracts and things like that. I will say no day is the same as it is for most folks on this call, but it is definitely rewarding. Even though I don't get to be a part of the day-to-day life of a person with dementia, I get to hear the success stories. I get to understand, what people's needs are and hopefully find solutions for that. And that in and of itself is really rewarding.
I love it. The image of an air traffic controller comes to mind after you've described you two, Victoria, because it's a lot of managing moving parts and herding cats in some ways, but also being really forward-thinking oriented. So very proactive, not necessarily reactive, which is often how we have to be when we're working individually with clients, is responding to their needs, as Leanne has done. So it's a great sort of other perspective on this work. Really, you're always thinking to the next season ahead of the next grant funding cycle, and how you can help folks be successful. Sorry, that's my phone ringing in the background. We are running a little bit narrow on time, so I'm going to punt to Susan, and then we'll wrap up with questions 6 and 7. But Susan, a day in the life at your workplace, again, if there is one, or one of your previous workplaces, and what's the best part about it? Oh, you're on mute, Susan.
I start my day in this office. This is my coaching therapy office. I do everything remote. And then I go into work for the software company at about 10 o'clock or so. I'm late on purpose today. And basically spend the day talking to various people on what they need changed in their software. And then I assess what it is. I come up with a plan, they agree with the plan, and then I kind of go in the background and do that. I've worked from home for since 2015. So I'm only working from home. So that is a benefit of what I do. And the challenging and the rewarding is really the same at both jobs. So being a therapist and a life coach, just being able to be part of somebody's life as they're starting to make these little small changes in what they do or how they're thinking and managing or feeling or something like that, watching them progress is just so rewarding. Same with my partners that we are what we call our clients in the software company, just watching them progress through, this is what their software is doing now. This is how I can help you. And then I can execute that and they start using it. And it's a very similar process, despite the fact that it's two totally different fields. And then the challenging part is also the same, because there are folks who I work with who sometimes their thoughts are just so stuck in the way that they're doing things now that it's just so hard to see that there's another option. And so just kind of sitting with them, like holding space for them to take whatever time they need to figure things out. It's challenging. It's like we're in a very let's get results society. And so sitting with somebody as they're going through their process, whatever that is, can feel a little bit challenging, but it's also in my mind just such a a sacred part of what I do working in direct care. And again, same with the clients we work with in the software company, you know, sometimes they don't want to change. This is the way we do things. I'm like, well, this is the way we do things with this EHR. And so kind of getting them unstuck to see that, hey, there's another option here and it may actually be more effective for you, is great.
Love it. I love that the common thread through all three of your perspectives on challenges and rewards are really the idea of being witness to people's success or sitting with them, like you said, Susan, in that space and making space for them to experience hard times. And whether you're doing it on an individual level like you and Leanne, or Victoria, if you're hearing about it, sort of a couple steps removed, but still knowing that decisions you made and work you did has made a difference for the lives of humans, really is a privilege in this job. And, you know, we joke about the pay is not the same as it is in other fields, perhaps, but I think we're all drawn to this work because we have an innate desire and need to help others. And that reward at the end of the day of knowing that you've made a difference in someone's life is a benefit that is not to be dismissed. It's amazing. We want to give time for audience questions. So I'll kind of punt to the last question. And if any of you also want to address your company's commitment to diversity, and I don't mean to give that short shrift, we could do an entire webinar, an entire panel on the importance of diversity in the workplace. So I'm almost hesitant to even bring it up just because I don't want to give it too little time. But essentially, you know, your words of wisdom to our audience, something you wish you knew before graduating, and that you can pass on to our audience. So Susan, since you're on screen, we'll start with you.
Sure. So I love my company because we have staff in Lima, Peru. We have staff in India. And so the whole diversity inclusion things just is great. And I get to work with all those different teams in what I do. One thing I wish I knew before graduating is something I probably have only learned in the last several years. And that is going through our education, we're very focused on achievement in the sense of don't fail, right? So you can't get a failing grade, you can't graduate with a failing grade. And that is just, it's always been so ingrained in us. But once you get out of a school system that is literally grading you, failing becomes an option in a lot of ways because, and this is the part that I wish I had known, is that we're either winning at something or we're learning. And so when we hit those failures in maybe what we weren't able to do, what did you learn from that? And that is what will get you moving forward. Whatever it wasn't supposed to be that way. Let's just move on and learn something from it, something from it. So I would say what I wish I had known is that I'm either winning or learning. So it would really help me be more compassionate to myself when I encounter whatever failures I thought I was going through.
I love it. You could say failure is an option, or even remove the word failure from our vocabulary, and it's
right.
more learning. And very often there's more value in learning.
Mm-hmm.
It does
so much.
Forward. Thank you, Susan. Leanne, how about you?
Well, actually, Child and Family has a lot of different self-committees. We actually have a DEI, Diversity, Equity, and Inclusion Committee, and we talk about how we can enforce that into our workplace. And I really do think we have so much diversity down in our Providence office just because we're so accepting of everyone's cultures. Whenever anyone within the agency actually moves up in the world or moves away, all of us have like this email thread and we all congratulate them. We never are jealous of anyone else's success. We're always supportive of each other, even if we barely know the colleague, but they're still within our agency. So I really like how Child and Family really does run a lot of their committees. However, one thing I wish I knew, well, I'm on the fence about because I'm still fairly new to the workplace. I wish I knew a lot more about Rhode Island's programs and initiatives for older adults, just because as I learned them, I realized that there could be so much more to be done for older adults, yet I feel that before I got into this internship, I had known almost nothing about any older adult services. I always heard about early childhood or early adolescence, but there's just so little out here for older adults. And even if there are, there's always a financial limitation, which it sucks because if I was in charge, I'd let all the older adults just have the resource that they need. Because especially now in our thriving generation where older adults are becoming, are much more alive and, are inclusive. So I do wish I knew more about older adult programs so I could definitely reach out. And I wish I knew how to write grants as well as Victoria over here. So maybe I could write my own grant within college.
I love that you said, or you thought, if I was in charge, I would encourage all of you to think, not if I was in charge, but when I am in charge, and that you all have leadership capacity. So when you are in charge, Leanne, and can make those changes, when you're governor someday, or director of human services, that'd be wonderful. And keep learning and talk to Victoria. I learned how to do grant writing in graduate school and after, and it's absolutely something that can be learned, and it's a great skill to have. So we'll punt that over to Victoria, and I'm so sad that we're coming to the end of our time because I could talk to all of you all day long. You're so fascinating. But Victoria, your words of wisdom, and then we'll have a minute or two for questions if any of our audience has questions.
Yeah, thanks. This has been really great. I think for me in my senior year and during the internship, I was putting this idea that I had to have a job like right away on a pedestal. And that was like my accomplishment that I needed to do. And I wouldn't expect anything less. And I think what I've learned is that I was lucky enough to actually do that, but that doesn't have to be the end all. You can continue your learning. You don't have to have it all figured out right away. And that's fine. And you can always change your mind. You don't have to be locked in, right away after school. There's so much more that you learn actually in the workplace, and you might decide to make a lot of transitions or shifts, and that is completely okay. And you might be thinking to yourself that it's a direct path, but, clearly hopefully from listening to all of us, you've realized that, people change their minds, and that is completely fine.
That's awesome. Changing your mind is not failure. Changing your mind is growth. So,
exactly.
And you don't have to figure it all out. And I won't try to speak for Susan, but since we're both coming up on the 30th anniversary of graduating from URI, I still have not figured it out. So you've got time. Ashley, I don't know if we have any questions in the chat or if folks want to raise their hand in the next minute or so.
No questions in the chat, but I do see some familiar names in HDF 381 this semester. These are all students who are working to find an internship for their senior level HDF 480 and 481. So if any of you have questions for Susan, Leanne, or Victoria about internships at their workplace or opportunities, I know when Leanne and I worked together, she already had her internships lined up because she's a rock star, but her organization has excellent opportunities for our HDF majors. So now is the right time to start asking any of those questions that you might have. Feel free to throw them into the chat or unmute yourself. Yeah, so
Thank you, Victoria.
thank you. Thanks for that, Victoria.
Sure.
Well, we'll wait just a few more seconds, but while we're waiting, I just first want to say thank you to Ashley and the Center for Career and Experiential Ed for hosting this and giving students this opportunity. As I like to remind my students, the internet didn't exist when I was an undergrad here, or it did, but only for scientists. So I love that we have these opportunities for you to get this information from amazing grads. And I cannot thank Leanne and Victoria and Susan enough for your generosity in sharing your challenges and your successes and just your experience. I think This has been a fantastic opportunity. I've learned a ton from the three of you today, and I'm so proud to call myself an alum of this program because you represent us very, very well. And I know our graduating class this year and future classes will also be doing the same. So I would say go Rhody. And it looks like we don't have anything in the chat, so I will just say thank you to all of you for coming and listening. I hope you found something valuable from today's panel. And again, thank you to our panelists for your time and sharing your wisdom with us today. And have a wonderful day. Thanks, Courtney.